Thank you for choosing intelligence. Name this anatomical area. Frontal bone. The frontal bone, also known as the frontis, Latin for forehead. Name this anatomical area. Frontal sinus. The frontal sinuses are mucosa-lined air spaces behind the brow ridges. Name this anatomical area. Parietal bones. The parietal bones are bones that form the sides and roof of the cranium. Name this anatomical area. Temporal bones are on the sides and base of the cranium, and lateral to the temporal lobes of the cerebrum. The temporal bone supports the temple and houses the structures of the organs of hearing. Name this anatomical area. Squamous portion. The squamous portion is one of the four parts of the temporal bone. The others are the mastoid, tympanic, and petrous. Name this anatomical area. Mastoid process. The mastoid process is a prominence that protrudes from the undersurface of the mastoid portion of the temporal bone, located behind the external acoustic meatus. Name this anatomical area. External auditory meatus. The external auditory meatus is also known as the ear canal. It is the passage that leads from the outside of the ear to the eardrum. Name this anatomical area. Internal auditory meatus. The internal auditory meatus is a canal located in the petrous part of the temporal bone, and is utilized as the passageway for the cranial nerves. Name this anatomical area. Petrous portion. The petrous portion is wedged in at the base of the skull between the sphenoid and occipital bones. It is one of the most dense bones in the body. Name this anatomical area. Styloid process. The styloid process is the pointed part of the skull just below the ear. Name this anatomical area. Mandibular fossa. The mandibular fossa is the depression in the temporal bone that conveys with the mandibular condyle and the temporal bone. The mandibular fossa is also known as the glenoid fossa. Name this anatomical area. Zygomatic arch. The zygomatic arch, also known as the cheekbone. It is formed by the zygomatic process of the temporal bone. Name this anatomical area. Occipital bone. The occipital bone is the membranous bone at the back and lower part of the skull. Name this anatomical area. Foramen magnum. The foramen magnum is Latin for great hole. It is a large opening in the occipital bone of the cranium. Name this anatomical area. Name this anatomical area. Name this anatomical area. Name this anatomical area. Name this occipital condyle. The occipital condyles are protuberances of the occipital bone which function with the superior facets of the atlas vertebra. Name this anatomical area. Sphenoid. The sphenoid bone is an unpaired cranial bone at the front middle of the skull, in front of the temporal bone, and basilar part of the occipital bone. Name this anatomical area. Greater wing of sphenoid. The greater wing of the sphenoid bone is a bony process of the sphenoid bone on each side, extending from the side of the body of the sphenoid and curving upward, laterally, and backward. Name this anatomical area. Lesser wing of sphenoid. The lesser wings of the sphenoid are two thin triangular plates, which arise from the upper and anterior parts of the body and project laterally and end in sharp points. Name this anatomical area. Optic foramen. The optic foramen is the passage through the orbit of the eye in the lesser wing of the sphenoid bone. Name this anatomical area. Sella turcica. The sella turcica is a saddle-shaped depression in the sphenoid bone of the human skull, and some primates such as chimpanzees and gorillas. Name this anatomical area. Ethmoid bone. The ethmoid bone separates the nasal cavity from the brain. It is located at the roof of the nose, between the two orbits. Name this anatomical area. Cristocaly. The cristocaly is a bone that projects from the cribriform plate of the ethmoid bone. Name this anatomical area. Cribriform plate. The horizontal plate of the ethmoid bone, perforated with many foramina, for the passage of the olfactory nerve filaments from the nasal cavity. Name this anatomical area. Perpendicular plate. The perpendicular plate of the ethmoid bone is also called the vertical plate. It descends from the undersurface of the cribriform plate, and assists in forming the septum of the nose. Name this anatomical area. Ethmoid sinus cells. The ethmoidal sinuses are two of the four paired paranasal sinuses. They are divided into the anterior, middle and posterior groups. Name this anatomical area. Superior concha. The uppermost bony plate on the lateral wall of the nasal fossa. Name this anatomical area. Middle concha. The middle bony plate on the lateral wall of the nasal fossa. Name this anatomical area. Inferior nasal concha. The inferior nasal concha is a bony plate inferior to the middle concha on the lateral wall of the nasal fossa. Name this anatomical area. Nasal bone. The nasal bones are two small oblong bones, placed side by side at the middle and upper part of the face, and form at the bridge of the nose. Name this anatomical area. Zygomatic bone. The zygomatic bone forms the prominence of the cheekbone. Name this anatomical area. Maxilla bone. The maxilla bone is considered an upper jaw bone that consists of the upper palate of the mouth. Name this anatomical area. Maxillary sinus. The maxillary sinus is the largest of the paranasal sinuses and drains into the middle meatus of the nose. Name this anatomical area. Alveolar process of the maxilla. The alveolar process is the thickened ridge of bone that contains the tooth sockets. Name this anatomical area. Palatine process of maxilla. The palatine process of the maxilla forms the hard palate and the horizontal plate of the palatine bone. Name this anatomical area. Palatine bone. The palatine bones are paired bones of the skull that are in the back part of the nasal cavity, between the maxilla and the sphenoid. Name this anatomical area. Vomer. The vomer forms the posterior part of the nasal septum. The anterior part is formed by the ethmoid. Name this anatomical area. Mandible. The mandible is the lower jaw. Name this anatomical area. Mental foramen. The mental foramen is one of two holes located on the anterior surface of the mandible. It allows passage of the mental nerve and vessels. Name this anatomical area. Mandibular condyle. The mandibular condyle is the condyle of the ramus of the mandible. It articulates with the skull. Name this anatomical area. Coronoid process. The anterior process of the superior border of the ramus of the mandible. Name this anatomical area. Ramus of the mandible. The mandibular ramus is utilized as a bridge attaching the jaw to the temporal bone. It also is where the masseter muscle attaches. Name this anatomical area. Alveolar process of the mandible. The alveolar part of mandible is the part of the mandible adjacent to the teeth. Name this anatomical area. Lacrimal. The lacrimal bone is the smallest and most fragile bone of the face. It is located at the front part of the medial wall of the orbit. Name this anatomical area. Anterior fontanel. The anterior fontanel is the largest of the fontanels and is placed at the junction of the sagittal suture, coronal suture, and frontal suture. Name this anatomical area. Posterior fontanel. The posterior fontanel is a gap between bones in the skull situated at the junction of the sagittal suture and lambdoidal suture. It usually closes 6 to 8 weeks after birth. Name this anatomical area. Anterolateral fontanel. Also called the sphenoid fontanel, is the membranous interval between the anterolateral angle of the parietal bone and the greater wing of the sphenoid bone in the developing skull. Name this anatomical area. Posterolateral fontanel. Posterolateral fontanel is also called the mastoid fontanel. It is an open area covered by a tough membrane, where the two parietal bones adjoin the occipital bone. This usually closes during the first 2 to 3 months of an infant's life. Name this anatomical area. Coronal suture. The coronal suture is a fibrous and dense connective tissue joint that separates the frontal and parietal bones of the skull. Name this anatomical area. Sagittal suture. The sagittal suture is a dense, fibrous connective tissue joint between the two parietal bones of the skull. Name this anatomical area. Squamous suture. The squamous suture connects the temporal squama with the lower border of the parietal bone. Name this anatomical area. Lambdoidal suture. The lambdoidal suture is a fibrous dense connective tissue joint on the posterior portion of the skull that connects the parietal bones with the occipital bone. Name this anatomical area. Hyoid. The hyoid is articulated to other bones by muscles or ligaments. The hyoid is anchored by muscles from the anterior, posterior and inferior directions, and aids in swallowing and tongue movement. Name this anatomical area. Sternum. The sternum, also called the breastbone, helps to protect the lungs, heart and major blood vessels from physical trauma. Name this anatomical area. Manubrium. The manubrium is the broad superior part of the sternum. The supraesternal jugular notch is medially located at the superior broadest part of the manubrium. Name this anatomical area. Body gladiolus. The body or gladiolus is the longest part of the sternum. It is flattened from front to back with two surfaces, an anterior and a posterior. It allows attachment on either side to the sternal origin of the pectoralis major. Name this anatomical area. The Ethmoid process. The Ethmoid process is located at the inferior end of the sternum. Name this anatomical area. Vertebrosternal rib. True. The vertebrosternal ribs that are considered true are the 7 upper ribs on both sides that have cartilage articulating them directly to the sternum. Name this anatomical area. Vertebrosternal rib. False. The vertebrosternal ribs that are considered false are any of the 3 ribs that are above the floating ribs, that are attached to each other by costal cartilage. Name this anatomical area. Vertebrosternal rib. Floating. The floating rib refers to the 2 lowermost rib pairs. They are attached to only the vertebrae and not to the sternum or cartilage of the sternum. They are relatively small and delicate, and include the cartilaginous tip. Name this anatomical area. Angle of rib. Also called the costal angle, is the sudden change in curvature of the external surface of a rib where the rib is bent in 2 directions and twisted along its axis. Name this anatomical area. Head of rib. The head of the rib allows the rib to articulate, and is located at the end of the rib, closest to the vertebral column. Name this anatomical area. Costal groove. The costal groove is the groove in the rib that contains the intercostal nerves and vessels in between the ridge of the internal surface and the inferior border. Name this anatomical area. Tubercle of rib. The tubercle of the rib is a projecting knob that allows for articulation. Name this anatomical area. Cervical vertebra. The cervical vertebra are the vertebrae immediately inferior to the skull. Name this anatomical area. Atlas. The first and most superior of the vertebrae that supports the skull. Name this anatomical area. Axis. The axis is the second cervical vertebrae in the spine. It also forms the pivot for the atlas. Name this anatomical area. Odontoid process dens. The odontoid process forms the pivot upon the atlas. Name this anatomical area. Thoracic vertebra. In humans there are 12 thoracic vertebrae. Thoracic vertebrae comprise the middle section of the vertebral column, between the cervical vertebrae and the lumbar vertebrae. Name this anatomical area. Costal facet superior and inferior. The superior costal facet is an area where a rib forms a joint with the top of a vertebra. Ribs attach to the thoracic vertebrae at two main points, the inferior and superior costal facets. Name this anatomical area. Lumbar vertebra. There are 5 lumbar vertebrae between the rib cage and the pelvis. They are the largest segments of the vertebral column. The lumbar vertebrae help support the weight of the body and permit movement. Name this anatomical area. Sacrum. The sacrum is a triangular bone at the base of the spine. It is inserted between the two hip bones. Its upper part connects with the last lumbar vertebra, and its lower part with the coccyx. Name this anatomical area. Coccyx. The coccyx, also referred to as the tailbone, is the final segment of the vertebral column. Name this anatomical area. Centrum body. The centrum or body is the largest part of a vertebra and is cylindrical in shape. Name this anatomical area. Lamina. The lamina are two broad plates that extend dorsally and medially from the pedicles, fusing to complete the roof of the vertebral arch. Name this anatomical area. Pedicle. The pedicles connect the body of the spinal vertebra to the arch. They are two short thick processes, which project dorsally, one on either side, from the superior part of the vertebral body at the junction of its posterior and lateral surfaces. Name this anatomical area. Spinous process. The spinous process is guided backward and downward from the junction of the laminae and is used for the attachment of muscles and ligaments. Name this anatomical area. Transverse process. The transverse processes is utilized for the attachment of muscles and ligaments. Name this anatomical area. Vertebral foramen. The opening that the spinal cord passes through. Name this anatomical area. Transverse foramen. The transverse foramen provides passage for arteries, veins and sympathetic nerves, depending on the location of each foramen. Name this anatomical area. Articular process. The articular process is either of two processes on each side of a vertebra that articulate with adjoining vertebrae. The upper area is the superior articular process, the lower is the inferior articular process. Name this anatomical area. Intervertebral foramen. The intervertebral foramen allows the nerves to exit and enter the vertebrae. Please support free education. We appreciate your subscription and your like submission.